Thank you very much. Thank you, Derek, for giving me the opportunity to present our next speaker, Dr. Lakany. She has gained experience in robotic and artificial intelligence as part of her PhD course. She qualified with a PhD in artificial intelligence, and ever since she really worked in robotic neurorehabilitation, applications of new technology to functional restoration, and also she's working at university currently as a reader in robotics and embedded systems, and she might want to tell us what these embedded systems are later when she's going to talk about her project. Basically, our project consists in assessing the efficacy of the robotic rehabilitation of the upper limb in tetraplegic patients. Nowadays, neurorehabilitation is very much focused on plasticity, recovery of plasticity, being this in the spinal cord or higher centers in the brain. But in reality, there is very little evidence that the robotic rehabilitation is much more effective than the conventional therapy we are currently offering. In fact, to give you just an example on how conservative can be the rehabilitation community, is that at Stoke Mandeville, and this being a very big unit with more than 100 beds, we did not have the Lokomat, which was very, very trendy and is in use in many rehabilitation units. And we actually don't even have the exoskeleton, which you will see being used in many neurological rehabilitation centers and so on. The reason is we adopt technologies and methodologies that are very much evidence-based. And therefore, we welcome very much the proposal of this research, because this is actually what we are after. We are after objective evidence that the robotic rehabilitation is equal or superior to the conventional physiotherapy. Of course, we do see the possible application of this research, and we do see that the robotic rehabilitation could well be a modality that we will be using to deliver rehabilitation domiciliary in the community, rather than what is the inpatient's rehabilitation that the newly injured patient will have in our unit. So we will hear more about this project by Dr. Lakany. Thank you.
Hello. Oh, thanks very much for the kind introduction, Mr. Belsey. It's a pleasure to be here. I hope that you can see my slides. So I'm here to present today assessing a wearable robotic exoskeleton for upper limb rehabilitation for people with spinal cord injury. In this presentation, I will cover the main objectives of the project, the funding that we have gratefully received from Stoke Mandeville Spinal Research, and the support that we have also received from the University of Liverpool as a result of the funding. I shall briefly introduce the commercial upper limb that we will be using in the study and who can benefit from this technology, so the participant or the patient profile. I will talk a wee bit about the intervention or the rehab protocol that we will be using or we are proposing, and the expected outcomes of this project. Finally, I'll show a video, a 2-minute clip from the company of a spinal cord injured survivor talking about his experience using the technology at home. So the main goal of this study is to assess a commercial exoskeleton for upper limb rehabilitation, and we'll do that through conducting a study on spinal cord injured survivors. And we were going to run a health economic study to assess the economical value of the technology for people with spinal cord injury. And we'll gather a feedback from participants and therapists and clinicians involved in the study about the functionality, usability, basically the pros and cons of the technology. I will do that on at least 9 patients in total on 3 different spinal units in the UK. We're proudly collaborating with Stoke Mandeville, Glasgow, and Oswestry. So we have received 110K that we will spend over 24 months. And for that, we'll be able to recruit one research assistant that will help us to deliver the study over the 3 sites. And we'll cover the consultants and therapists time and the health economics study as well, in addition to some kit. And because we were successful in securing that funding, the University of Liverpool agreed to fully fund a PhD studentship for 3 years to support the work of this project and cover all the admin costs and sponsor the study. In addition to that, Myomo, the company, agreed to loan out the device to centres involved in the study who do not have yet the device. So because of the funding, it's not just the funding that we got also further support from other parties, and we're thankful for that. So here's the device. So this is the MyoPro, and it's produced by an American company called Myomo. It is basically a brace or an orthosis, so it's wearable. With a lot of sensors and a couple of motors that enables the sensors enables measuring the residual muscle activity in the arm, and the motors enable the flexion and extension of the elbow, opening and closing of the hand. The function relies on the actually user's intention to move, and then hopefully the magic happens. We're going to use a research version of what you're seeing. It looks exactly the same. It's just got some additional researchy stuff on it. And as you may notice here, the brace has no shoulder, so it's just the elbow and the hand. And that for that there is a particular really profile for patients who will mostly benefit from this technology. And we, together with the clinicians and the company, we've worked out this profile that you see here on the slide, and this basically will be the inclusion criteria for our study. And so the intervention program will be for 12 weeks for at least 48 sessions of robotic rehabilitation. We've just heard that rehabilitation need to be really intense, and so at least 48 sessions we'll try to achieve that. We will assess various physiological and functional measures pre, post, and halfway through the program, and we'll do that on 9 patients and compare them to matched controls who will be following standard care. Main outcomes of our study is a comprehensive assessment, a subjective and objective as well assessment of the MyoPro on people with spinal cord injuries. To the best of our knowledge, and the company tells us that this has not been done to date. They have done studies on stroke survivors and brachial plexus survivors, but they have not done anything on spinal cord, and they are very keen on this study, and they are supporting us in every way they can. In addition to this assessment, a health economics study will be focused on people with spinal cord injuries and using the MyoPro. And we, as I mentioned, we're going to be gathering all the feedback and compiling a requirement specification document on rehab robotics for upper limb for spinal cord injured patients. In addition to these deliverables, of course, this study will introduce the technology into the NHS, and we will be training the therapists involved in the study on this technology. Right, so here's the video that I promised. So this is a spinal cord injury survivor who has been using the device, and I'll leave you with his experience.
My injury was about 4 years ago. April will be 4 years. I was running in a mud run and went to dive into the first pit, and when I dove in, hit something and it broke my C4, C5 vertebrae, and so I have a spinal cord injury. As soon as it happened, I mean, I knew immediately. I was face down in the water. The Marines that were there, along with the people that was running with me, knew something because I just came and floated at the top of the water. It paralyzed me from right around about the shoulders down. And I didn't have any use of my arms or my legs. And with, like I say, therapy, I've gotten to where I can move my arms just a little bit. I still can't, do anything for myself. I still have to be fed or what, people give me drinks or stuff like that. I can't do anything on my own without help. When you go from, me being almost 4 years since my injury, not being able to move and do anything for myself, when I get the MyPro arm on and can feed myself bananas or something like that. I can feed myself and actually get myself something to drink versus having one of my family members come in, whenever I want something to drink or something like that. I can do it on my own. That's a big progress for me, to be independent instead of dependent on someone. What my injury was about.
Okay, so thanks very much for your attention, and I'm happy to take any questions if you have.